Dear Dr. Parimi, I didn't know for sure what would happen when we got to the hospital last week. We can't thank you enough. Your professionalism, thoroughness,
and most importantly, the warm and endearing smiles made this trial something that we're going to fondly remember for the rest of our lives.
From the day you know you're pregnant, you realize that many decisions you make will affect the baby growing inside you. And one of the biggest decisions is where to deliver. A comfortable place with a warm, supportive staff, and the expertise and equipment to handle an unexpected emergency. That's what patients find here at the University of Kansas Hospital. When you walk into one of our birthing suites, you'll know it was designed for you to relax.
They're very homey, and the bathrooms are great. They're nicer than some really nice hotels because they're so big, and the showers are great. So I think it'll be a good experience for me.
A big part of what makes the experience special here is the caring team of nurses that goes through a mom's birth experience with her.
We feel all the emotions that they have, and if we've had babies ourselves, it brings us back to those moments as well. I've had 2 babies here myself, and I had wonderful nurses and doctors and residents here for both deliveries.
But as comfortable as these suites are, their beauty is more than skin deep.
Obstetrics is the only profession where you go from a nice, normal, intimate environment to an intensive care setting within minutes. No other specialty has to do that.
Problems can develop in childbirth. Each suite is equipped with state-of-the-art monitoring systems, and the cabinets hold an array of sophisticated equipment that can be set up and working in minutes. And just one door away is an operating room and a staff well-trained for emergencies.
We are, for the United States, the central site for an obstetrical simulation training course called PROMPT. With PROMPT, we all practice as a multidisciplinary team, doing things that occur rarely. Since we've started, cesarean section rates have plummeted here at the University of Kansas Hospital.
One way to minimize emergencies is to diagnose and treat problems early. Our Center for High-Risk Pregnancy is completely focused on the treatment of pregnant women with conditions that could threaten their health or their babies. The hospital's Center for Advanced Fetal Care uses state-of-the-art techniques to identify risks. Then with surgery or medical intervention before delivery, a fetus has a better chance for survival and good health. But even with intervention or a normal pregnancy, not everything always goes as planned. That's when it's even more important to have doctors and nurses who are the best in their fields.
The outcome data at the neonatal ICU is better than the national benchmark with respect to survival, as well as survival without long-term complications.
And data alone doesn't tell the whole story about the care provided in our neonatal intensive care unit.
When a baby comes into the NICU, we really try and involve the whole family in their care. So while we're taking care of the baby physically, we're also taking care of the family emotionally.
The key thing is how University of Kansas Hospital is uniquely positioned to care for the mother, baby, and beyond hospitalization that nobody else provides. There's a whole continuum of care.
Everyone has fears, and they have fears because life isn't always perfect. The smartest thing anyone can do is be prepared. If you're going to have a problem, you want it in a place that can deal with it right away. That's the best security I can think of.
The University of Kansas Hospital, for a continuum of care from labor through recovery. And from our family to yours.